Hi, my name is Shanna Littlejohn. I'm a respiratory therapist and I've been working at Unity for 7 years. There are several different ways that we can administer oxygen to our patients. First, we typically use a nasal cannula, which depending on the kind of cannula goes all the way up to 6 liters of oxygen or 15 liters of oxygen. Next, we would use a non-rebreather mask, which delivers 100% oxygen using 10 to 15 liters. After a non-rebreather, we would move a patient to a BiPAP machine, which administers positive pressure through a mask to help decrease the patient's work of breathing and to give a specific amount of oxygen. After a BiPAP, if a patient is still having trouble breathing, we would intubate them using an advanced airway, and this is used for respiratory failure or impending respiratory failure, and then the patient would be placed on a ventilator. With the high flow oxygen systems that we have at Unity, we are able to now provide an additional step in providing oxygen to our patients. We are able to deliver up to 60 liters of flow to a patient with up to 100% oxygen, decreasing their work of breathing and hopefully preventing the need to place the patient on something like a BiPAP. Some of the benefits of a high flow oxygen system are that it can be used on both adult and pediatric patients. It has more settings than a traditional nasal cannula, which allows us to tailor those settings to the patient depending on what their oxygenation needs are. The high flow oxygen system allows a patient to be able to do things like communicate and eat and drink while they're receiving oxygen therapy, which is something that they would not be able to do with a BiPAP mask. And it can also, again, prevent a patient from needing a BiPAP mask if we are able to provide the oxygen that they require with the machine. Additionally, the high flow oxygen system gives us the ability to keep patients at Unity that we in the past would have had to transfer to a higher level of care due to their increased oxygen needs. Some examples of how we've used our high flow oxygen system over the past year have been for patients who currently have pneumonia or are recovering from pneumonia and aren't quite sick enough to require a BiPAP but are still too sick for a regular nasal cannula. We've also used them for patients that are unable to tolerate a BiPAP mask and their oxygen needs can be met using a high flow oxygen system. And then we've also had patients that have been able to use the high flow oxygen system to prevent going on a BiPAP machine, and then we have been able to successfully wean them off of high flow oxygen and then eventually to no oxygen at all when they are improved.